following is a lecture about professionalism from Dr. David Harness as you begin your CS1 course. Enjoy.
Look at what is a professional, what is professionalism, and so I'm going to look at a few quotes. Here's a quote from Frank Tiga. Professionalism is knowing how to do it, when to do it, and doing it. What's that about? What do you think that means? Well, part of what that is talking about is what we call competency, being able to do something, being competent. So competency is part of this understanding of what it means to be a professional. A professional is someone who can do his best work when he doesn't feel like it. Alistair Cook. A professional is someone who does his best work when he doesn't feel like it. And a professional will not give the impression of not wanting to do his work, or being tired, or letting his emotions get in the way of his work. So yeah, even when he doesn't always like that work, he won't give you the impression that he doesn't like it, but give his best at all times, no matter how he feels. Here's Ben Affleck, famous actor. He says, "All I do, really, is go to work and try to be professional, be on time, and be prepared." I like that. It's honest. He's trying to be a professional. I don't think he's saying he's arrived there, but part of that is being on time and being prepared. Like we talked about earlier, just about reading or watching the Moodle talks, being ready to come to class. Only those who care about you can hear you when you're quiet. I put this in just to give an idea as to the ethos of our course. Only those who care about you can hear you when you're quiet. And it's really looking at communication and consultation skills. What does it mean to be a professional in the way that we interact with our patients? And part of what we want to instill or pass on to you is that idea of caring. But how do we care? How do we show we care? Here is one aspect of that. Only those who care about you can hear you when you're quiet. They notice you. They notice when you're in the consultation there's something wrong. They see there's something more behind just the symptoms that you come with. They try and interact with you and try and understand your ideas, your concerns, your fears, what you're feeling about these things. And that's part of what we're also trying to teach in our consultation skills teaching. This is a quote from Robert Noyce. If ethics are poor at the top, that behavior is copied down through the organization. If ethics, the things we think, the things we do in our actions, our behaviors, our attitudes, are poor at the top, that behavior is copied down through the organization. And here we really want to look at our attitudes, our behaviors, our moral compass, how we behave. As a professional, there is something in our moral conduct, our ethical conduct. And that's, again, something we really want the best from you. We want to see the best, we want to help you be the best in all aspects of your life. But in a professional, doing the right thing, conducting ourselves in a way that is beneficial for the patients. We don't want to do any harm. We want to do benefit, and we want to do what's right by the law and what's expected from the public. So I thought I'd just start our interaction with what are the traits and behaviours of an unprofessional doctor. I've given you a few quotes. I've given you a few ideas. Let's turn this question on its head. What does an unprofessional doctor look like? Have a think. Here's a few ideas I came with. There's many more. An unprofessional doctor, well, is often rude, impolite, has poor communication and consultation skills. In their attitude, they don't really care about the patient. In fact, it's all about them. They're very doctor-centered, not patient-centered. Maybe the doctor forgets to wash his hands when he examines you. The problem is this doctor who's unprofessional doesn't have the knowledge or skills to carry out his job. Perhaps he doesn't even examine the patient. Just listens quickly and then just quickly writes a prescription without examining the patient. Really trying to understand, is there anything important to look for? Perhaps they're unethical in their conduct. They do something harmful to the patient, something outside of the law, maybe unethical in their examination as well. Even breaks the law in what they prescribe or how they act with the patient. Sadly, this is a problem everywhere in the world. What is the ethos of our course? What are our aims? We want to develop you to become doctors who are competent, who are caring, and are professional. We want to equip you to be competent in the consultation, how you use your consultation skills with good communication skills to get the right information, to interact with the patient in a patient-centered manner, and to help the patient understand their problem and to help give them some options and ways of treating that problem. We also want you to be competent in how you examine the patient, having the skills, knowing what you're looking for, how to look for it, and demonstrating competent examination skills. As well as procedural skills. The procedural skills we'll be showing you, like catheterization, lumbar punctures, suturing, basic life support, all these skills of a doctor. We want to help you to become competent in those areas too. In caring, we want to inspire you to show care for the patient, putting the patient first, being patient-centered rather than doctor-centered. That's why you want to be a doctor. Part of that is helping and caring for people. In professionalism, we want you to obviously uphold the ethical and moral behaviours expected of you by the public, your patients, but also by the law of the land too. So you may say, okay, this is all very idealistic. To be a professional, be caring. Why show care, empathy to patients? Shouldn't doctors just get the right diagnosis, give the right treatment, and hopefully the patient will get better? Well, we want to go a bit deeper than that. We are human, and in our interactions with other humans, there's part of being human, showing care and empathy, the best side of our human side. It's also, there's a relationship going on between the doctor and the patient. And so empathy and care builds that relationship. There's also studies to show that patients are more satisfied with the consultation if they feel their doctor cared and showed empathy to them. And that is good because patients who are more satisfied are more likely to take their treatments, more likely to get better too. There's good studies to show that where there's been support and empathy shown to patients with cancer, that they survive longer, live longer. There's also studies to show that people's blood pressure is better controlled if we show empathy and care. Also, if we show empathy and care, the patient's more likely to give us more information, more relevant information, and we get more from them. I said it's been part of being human, but also empathy is a skill. It's a consultation skill. It's not just a personality trait, oh, they're a caring person, but actually we can learn how to be caring, we can learn how to be empathetic. And that's hopefully one of the things we'll be able to teach you too of this course. So how do we show care, empathy? Well, part of that is listening, and listening well. Not interrupting the patient, being attentive, giving good eye contact, and understanding the story, being able to repeat the story back, showing that we've listened. Another aspect is exploring the patient's thoughts, their ideas, their feelings, their fears. Also, we will pick up cues, whether that's verbal or non-verbal, in their facial expressions or in the words that they say. Patients are always giving us cues, giving us clues as to their feelings and thoughts and their worries. Often in the silence and the things they don't say, they're giving us a clue or a cue. We also show care by the use of our language, what we say. And using empathetic statements can be really helpful to show empathy and care. When you see patients, or when you will see patients, you'll come across patients who are upset, in pain, or angry. And recognizing that is really important, showing that you care. Also trying to understand that anger, that upset from the patient's perspective is really important, to step into their shoes. And finally, the human touch is very powerful. I understand that's different here, and where it's culturally appropriate, touch is a very good way of showing care and empathy. So we also talked about care and compassion, empathy. We've also mentioned this idea of being patient-centered. I guess this is maybe a new idea, where there's different ways we can be patient-centered. One is in our clinical settings, how we arrange the seating, how we arrange the room, how we make sure the consultation has no interruptions. All our focus is on the patient. Also in our communication and consultation style, being patient-centered in the way we talk with patients versus being doctor-centered. And we'll go in that in more detail in the lectures to come. Also in our examinations, that we put the patient at the centre again and make sure they understand what's going on, they've got informed consent, they can say no if they so wish, but also offering them a chaperone, particularly when it's the opposite sex that we're examining. And we also want to continue to work for our patient. We'll complete the tasks that we need to do, we'll finish the work we'll do, and we won't give up. We'll keep going until we find the diagnosis, we'll keep going until we've understood what's going on and continue to do our best for the patient. So take, for example, the consultation room. How can we make for a more patient-centered approach? So I just want to look at these two different consultation rooms. The room at the bottom is a more traditional doctor-patient room. Notice the certificates on the wall on both sides. Notice the lovely desk between the patient and the doctor. Even the seats, the doctor's in a higher seat than the patient's lower seats. Yeah, it's quite a different feel to the doctor here, with an open space between the patient and the doctor. They're both at the same seating level, and they're both working together as they look at the screen. And there's an interaction going on, a dialogue, almost a conversation about this patient's test. It's a very different feel. How we set up the room, how we look at the consultation from a doctor-centered approach to a patient-centered approach even begins with the setup of the room and how the doctor views themselves. Here, the traditional, doctor-centered approach, there's a barrier to communication with the desk. All these certificates are quite foreboding for the patient, quite intimidating. The patient's below the doctor in the seating, whereas in the top picture it's more of a partnership. There's no barriers between them. It's a conversation of equals, and we are trying to create that partnership with working with patients in that doctor-patient relationship, trying to get them on board, trying to understand their perspective. It's a lot more relaxed surroundings. There's less of an intimidating feel. Again, why be patient-centered? Again, similar to the empathy question, there's definitely improved patient satisfaction with consultation if you're patient-centered. We talked as well about empathy, but the same thing with treatment here. If the doctor shows more patient-centered behaviours and ways of interacting with the patient, this leads to high levels of patient compliance with treatment. The studies show that blood pressure is better controlled, as the Orth and al. 1987 trial showed. Again, interestingly, if a doctor misses a patient's emotional cue, or how upset or angry they may be, or misses their fear or worry, these doctors tended to have longer consultations too than those who did respond to the patient's cues. So Levinson showed that basic doctors who pick up cues, emotional or verbal cues, tended to have shorter consultations, so it actually saves time. Again, a doctor understanding improves. So if a doctor is more patient-centered and asks the patient what they think is causing illness, often patients have thought about this and come with some ideas themselves. And actually, that can actually help the doctor, because he may not have thought of that himself. And in fact, 90% of the cases in a study showed that a doctor is actually able to make a diagnosis from the patient's ideas. So areas of professionalism that we want to focus on in the clinical skills lab: how to approach the patient, showing the right approach, introductions, getting privacy, whether the patient needs a chaperone or not, making sure we've got the right environment, the right beginnings to the consultation. Being patient-centered, we've already talked about that. Being professional in the way that we dress, in our manner, politeness. Developing empathy and care for patients. Also, the professional will offer chaperones in examinations and explain the procedure, explain what's happening, get informed consent to continue. We'll also look at more difficult areas, sensitive areas, and how to be a professional asking patients questions in those difficult areas, and the need to maintain patient confidentiality. What is said in the consultation room stays in the consultation room as a true professional. We also want to help you work in teams, teamwork, for example, in basic life support and advanced life support. We try and get you to work as teams in that. And also just focusing on what's ethical, what's right, what's moral in the way that we practice medicine and following the law. Here's a quote from Hippocrates from thousands of years ago. He said, "I swear by God, I will use treatment to help the sick, according to my ability and a judgment, but never with a view to injure and wrongdoing." This is one of the first ethical principles of do no harm. Do no harm to your patients. Neither will I administer a poison to anybody when asked to do so, nor will I suggest such a course. Similarly, I will not give a woman a pessary to cause abortion, but I will keep pure and holy both my life and my art. And here Hippocrates says, look, life is sacred. Life is given to us by God. Therefore, we should value it highly. Into whatsoever houses I enter, I will enter to help the sick. And here we have Hippocrates saying, I'm going to do good. I'm going to help. And I'll abstain from all intentional wrongdoing and harm, especially from abusing the bodies of a woman or man, bond or free, whether they're a slave or free. So here's one of the big temptations, the power of the doctor, the temptations to do wrong, unethical behavior. And whatsoever I shall see or hear in the course of my profession, as well as outside my profession, my discussion with men, if it be what should not be published abroad, I will not divulge, holding such things to be holy secrets. So here, Hippocrates is saying, look, what is said in my interactions with patients, I will just keep between me and the patient. That's a really strong founding principle of patient confidentiality. We keep the secrets of the patient to ourselves. And then he carries on the oath. Now, if I carry out this oath and break it not, may I gain forever reputation among all men for my life and for my art. But if I break it and forswear myself, may the opposite befall me. So medical ethics, as highlighted some of them by Hippocrates himself. We haven't got too much time to go into all of these now, but patient autonomy is the idea that the patient can choose. They can choose the treatments that we offer. They can choose whether they want to be examined or not. They have their own choices. Patient confidentiality. This is the idea of protecting the patient's information, that we don't share it with others. That we agree to keep that doctor-patient interaction, just secret and within the consultation room. Consent is the informed choice to choose. So we give consent to patients to take a history, to do examination, to do procedures. We tell them the risks and the benefits, and we explain what we're doing so they can choose. Beneficence is the idea of doing good. Non-malevolence is the idea of not doing harm. And justice is doing the best for everybody, fairness. The NHS in the UK is a free health service for everybody. But because it's free for everybody, we have to also make decisions as doctors of certain treatments we will not do because of cost, and certain ways of things we'll do because it's the best for everybody that we do that certain thing, even though the patient in front of me may feel they should have the right to have an expensive treatment. So what is professionalism? To summarize, it's a set of values, of behaviours, relationships that underpins the trust the public has in doctors. So we show our expertise, our competency in the knowledge and skills we display. We keep high standards. We're respectable in the way that we appear and dress and are in manner with other people. We show responsibility and reliability. We keep to time. We're punctual. We complete the work tasks that we said we'd do for the patient. Probity is this idea of being good, honest, upright. Conduct is our behaviour, so that's also our good and open behaviour. And finally, respect. Respect for patients, also respect for the law, and respect for patient confidentiality and privacy. Again, be the best, be dependable, be a team player. You want to be professional? Be respectful, be positive, and be ethical. Thank you for listening. Just a quick aside, if you're thinking about what books to get, what to read, then I'd recommend MacLeod's Clinical Examination. If you want to go deeper into consultation skills, then the model we follow is the Cambridge Calgary Guide, which you can get online, and you can have a look at that. Now, it's got lots of skills on there, but just begin to look at the introduction to the patient, how to show active listening, open to closed questions, some of the earlier skills in that. I hope that's been helpful, this talk. Do interact with us online or during the teaching. Thank you.